Jake here with Action for Liberty. Welcome back to our show where we expose corrupt politicians and lying corporate media. I can't wait to discuss the things we story, and I can't wait to get into this. But first of all, if you watch our show on YouTube regularly, which you probably don't because we've kind of moved away from that platform for good reason, you're not able to do that today. Why is that, Dawson? Dawson, who's running our control room over there with William Beck. I'm sorry. I totally forgot to introduce William Beck, who's taking Bridget's place, reading your comments. So if you want to join our conversation, William will read those on air, and Dawson running the dials. But Dawson, what did we find out this morning before we started the show? Oh, you need the mic?
YouTube decided to take down our previous live stream because we talked about vaccines with a doctor and they didn't like it.
Exactly. Pull up the graphic here. I want to show you guys. This is what happens when you're Action for Liberty or Stop the Mandate. Or Susanna, didn't you say your YouTube channel got taken down temporarily?
Yeah, actually it was a conversation I had with another vaccine injured in the UK, and she titled our episode Kindness, since I talk about team humanity and pulling together for kindness, and they took it down. We barely talked about our injuries, and we mostly talked about team humanity.
Well, but you can't pull together on kindness. That would be against what they want, right? To divide us. Unbelievable. All right, so this is Action for Liberty's YouTube page. I don't know how many years we've had this page. We just started getting more active recently. So you see September 7th on the top. That was when MAGA Jesse responds to Biden's speech. You have to be insane to not think what Biden said was a crazy and a really big problem for the health of our country. And we got, I guess it wasn't a strike, but for some reason it was considered misinformation for even discussing what the President of the United States talked about. Then on September 20th, we got our first actual strike for misinformation. The show was about the feds tracking gun purchases. What they said was our violation was we had a little bit where we discussed the 2020 election, which, by the way, no conclusion here. We discussed it. Can't do that. No. If that wasn't bad enough, we got strike number 2. I assume they play by baseball rules, so 3 strikes are out. And was that today? No, did we have the strike 3 days ago and we just didn't know about it? I think so. Oh, okay. Shows how much we've invested in YouTube lately. Yeah, I guess they don't notify us very well. So anyhow, it says medical misinformation. So pull up the next graphic there, Dawson. And this is what they're referencing, the show. It says policy violated. YouTube doesn't allow claims about the COVID-19 vaccinations that contradict expert consensus from local health authorities or the World Health Organization. The show that they're referencing was with the medical doctor, Dr. Neil Shaw, a medical expert. And we didn't come to any conclusions. We just said there's a lot of deaths going on. What's explaining these deaths? And we have to leave open the possibility that the vaccines are the cause of the death. And that, according to YouTube, is not allowable because it's not part of the approved agenda. I don't know, I guess from the WHO. Aren't the Chinese like big and influential in the WHO?
Yeah, they play a huge role. I don't know how much of a role, but a very large role.
So we're taking our marching orders from the WHO, I guess. China. So anyhow, we have an appeal process. Go to the next screen here. Yes, we want to appeal this, removing the content. Would you like to share anything with us? Yes. And I write, we discuss an important medical issue with a credible medical doctor who is a Mayo-trained physician. If this discussion is not allowed to happen, YouTube is disrupting the scientific process. The scientific process works by sharing information, especially from credible scientists or medical doctors. And so what they're doing is they're disrupting the whole medical process, the whole scientific process, if we can't discuss this thing, which is very important. And we're not like out there the only ones talking about this. And I'm going to go to a clip by Megyn Kelly, which is really interesting. And somehow she's not removed for saying what she says on this clip. But go to the next one. Once I submit this, they let us know that most creators never get a second strike. So this is how YouTube, which is owned by Google, silences people. or censors people who are actually against the normal narrative. They scare them enough on the strike one where they don't even touch these topics ever. And so, I said to Dustin, I go, well, screw them. We're going to keep talking the way we were going to talk. He's like, well, you probably don't want to do it on YouTube here, so we get removed and lose all of our content. So I think what we're going to do is probably not.
Says, I wouldn't invest anything into YouTube. Why contribute anything that could provide any revenue to an organization that supports censorship of freedom of speech?
That's a fantastic point, Mandy. And the only reason we do it, and we don't really invest anything, we just post our video there, okay? Most of our investments in Rumble at this point. We get 200-300 views on YouTube. There's still people that use that. Listen, I use YouTube. I have a lot of interests like hunting and tools and stuff like that. So I'm going to YouTube all the time, right? They got good content on YouTube, obviously. But, and we want to capture those people that are already on the platform and follow us. So to me, it's just like the group, which had 50,000 followers. What do we call that, William? Was it Rally for V-Choice? And by the way, they had to call it V-Choice because once you put vaccine, the algorithm says, uh-oh. And I think they've even caught up to the V. I think they know that. Unbelievable. So I put on our Facebook post today, the needle. I don't know if that's catching the censors. So pull up the last graphic. This is, we did a very important issue-based mailer statewide, and we backed that up with Facebook ads. It kills me a little inside to actually run ads on Facebook to even give those guys revenue. And meanwhile, they're laying off 13,000 people, so they don't even want your revenue. It's crazy. But this was stopping the Democrats' plan to mandate the experimental COVID vaccine on our children. If you're not following this story, the CDC recommends the COVID vaccine in the immunization schedule for 2023. And a lot of states, like Minnesota, might adopt that then for what says if your kid can go to school or not. And that's not just public school, by the way. That's private school as well. So they said that this went against their community standards and removed our Facebook ad. So anytime we want to discuss these topics that are very important, we get censored. And thank God for Rumble. Now, if you guys are following us on Facebook right now, let's hope the stream stays up. But if it doesn't, just go to Rumble right now and look up Action for Liberty. I have hope, Mark, that Rumble is going to be good because Stu Peters just, or the fact that we can't even discuss the vaccines with a medical doctor who is trained by Mayo.
I have to say, from my own personal experience, I was initially shocked when I spent 2 nights at that prestigious institution, and I thought they would want to study me more. I literally thought, okay, I'm here. I'm having a reaction. At least I'm in the right place. I've come to the place that cares about research of, odd reactions, and I'm having one. And 2 years later, I can say we're still not studying the vaccine injured, with the exception of Yale is doing a listen study on the vaccine injured, thankfully. But we are part of the science, like you said. And if we don't dive into our reactions, more and more people will continue to get hurt. And it makes no sense whatsoever to not consider the vaccine injured as part of the science.
So explain why you initially got the vaccine, because I know there are guys like Mark and I said, no, not a chance. And maybe we just had that foresight because we had delved into politics. You don't even come from the right side of politics traditionally, right? You come from maybe more on the Democrat side. Yep. So what led up to the decision to get the vaccine, and then tell us about what happened?
Yeah, I have voted straight down the Democrat Party line my whole life. And I heard what was asked of me. I had a mom and a sister who had some comorbidities. I had teenagers in school, and I thought, well, I want to do my part. I believed the narrative that we needed to quick do our part, and I was literally excited to do my part. I got my first shot, no issues, and then it was my second shot that took me down. But I felt proud at the time.
And so that's either Pfizer or Moderna, because those
It
were
was
the two shots.
Pfizer.
Gotcha.
Yep, it was Pfizer. April 13th, 2021 was the date I took my second Pfizer shot, and I will never forget that date because it has changed my life.
All right, so first of all, Moderna is supposedly more potent, right? So you got the less potent one, Pfizer. What happened?
Well, within 30 hours, I had severe issues. I had a huge lymph node on my neck start swelling up. I had this rash on my forehead, which actually I still have today and kind of comes and goes, and extreme debilitating fatigue, like a fatigue that I do long distance biking. I do the MS 150 bike ride from Duluth to Minneapolis yearly. So that's, 75 miles in a day, which is not small, and followed by another 75. And I felt like I had done 300 miles, like something was wrong. And then my family started noticing that I had brain fog. I was valedictorian of Cretan-Durham Hall in St. Paul, and my brain wasn't working. So, and people were noticing. And then I was running into doors. So lots of crazy things started happening, and I knew something wasn't right. And I was still kind of afraid to tell people. I thought at that point in time, I did not want to create hesitancy. I'm like, all right, I pulled the short straw. I'm not sure why, if it was manufacturing or something genetically wrong with me. But, I don't want to scare people, but this is pretty bad. So I waited 2 weeks to go to the doctor.
Oh my God. So you had those symptoms? Huge fatigue, as if you did a 300-mile bike ride and you didn't even go to the doctor?
I waited 2 weeks. I was hoping it would get better, and it got worse.
Is that all because of the stigma attached to it?
I think I had so much hope, to be honest. Like, oh, this is it. This is just going to happen. Like, and maybe doubt, because the narrative had been safe and effective.
Right.
So I'm like, all right, well, it's safe and effective. So I just need to wait this out. And, the lump kept getting bigger. I was trying to treat it at home myself with like hot compresses, and the fatigue and the dizziness and all of it just kept getting worse and worse. And I finally went in, and now I am a frequent flyer at the doctor with so many specialists, and really getting not very far on the Western medicine side, but having more luck with some alternative therapies and changes to my diet, which was already pretty good. I'm a pescatarian.
What the heck is that? You gotta explain.
It's like a vegetarian, but somebody who eats fish still. So I eat a lot of fruits.
Are cute and you don't really
yeah,
no attachment to
bears are so cute. I don't want to hurt them, or not bear, I guess, like cows. And I made that decision. It wasn't even really the decision to be vegetarian a long time ago, a few years back when I was watching a bunch of documentaries. I did what I'm doing now, or what people should be doing. I watched a bunch. I'm like, eat meat, don't eat meat. And I watched a whole bunch. I wanted to hear both sides before I made my decision. I thought, well, they're saying it's inflammatory over here. I can't control what the animals that I'm eating are eating, but I could control what I'm eating if it's direct, fresh food. So after doing a lot of research and then trying it out on myself, and I think everybody's different. Just because maybe being a vegetarian might work well for my body, it doesn't mean it's going to work well for your body.
Oh no,
frankly.
I was built and meant to eat meat. There's no doubt in my mind about that.
Yeah, and I know there are people who stick to purely meat too as a diet. I've
Which
heard
is
them
fascinating.
too.
They're not falling over dead. You wouldn't think that would work.
Well,
You
when you do
wouldn't,
that kind
but-
of thing, you have to eat the organ meats too, because if you're eating grass-fed livers and spleens and kidneys and all these things, you do get liver's got so many nutrients.
I'm
minerals.
aware of that. Have you had
But
liver?
It's not good. So
Yeah,
I
I've
actually
kept
take
the liver on my
capsules.
deer, and I'm like, I can't. Oh, how do people eat this
People
stuff?
desiccate it or dehydrate it and put it in capsules. That's what But
Yeah.
you can eat a carnivore diet.
I'll eat
if you
fish oil in a capsule, no doubt about it.
Yeah. But there's a way of doing it that you can sustain very healthy.
Right. So you got healthy dietary regimen. You're into fitness. You're a triathlete. You bike and all that kind of stuff. I'm really interested in this 2 weeks, because that's just beyond me that you would not go to the doctor suddenly, because the way you just paint that picture, it's like, this is really bad. Like you're so fatigued. You're running into Walls? That's not good. You don't want to run into walls.
But they actually, they created that anticipation in people because, I worked in the hospital and everyone around me was getting it. And it was like the day after, they're like, how you feeling? How you feeling? Like, and many people, you were supposed to feel a little sick. That's how it meant it was working. And so I'm sure to feel a little off, you were told that you might not feel well for a few days and you're just hoping it goes away, I'm sure.
Yep, exactly. I think I was just waiting the standard 2 weeks. And I'm like, okay, if I have kind of an illness or feeling like, even though it was extreme. I think, as more of an athlete, and throughout my whole life, just pushed through things. So it's like, I'll just push through this. It'll be fine. I'll just push through this and support my system and it'll get better. And here I am, a year and a half later, and a few things are better, but there are some things that are worse too. So
but in that
concerning.
2 weeks, it was progressively getting worse. Like before you went to the doctor, was it just the 2 weeks, or was there just something that you said, I have to go in at this point?
Yeah, I mean, it was the 2 weeks, and then I went to the doctor, and we started a whole series of tests, which many of them were coming back okay. I did an MRI.
Well, first of all, what do you say to the doctor? Do you say, I think I'm injured by this vaccine?
And I didn't really go to the doctor before this. I didn't really have a need. I wouldn't even go annually. I probably went every 2 years just for a checkup or do a cholesterol check or whatever. And so I knew this woman, but not real well, this nurse practitioner that I saw. And, she retired pretty early after I saw her. And I remember I don't know what's wrong, what is this? What could this be? And she looked at me like she knew what it was, not saying anything, but she's like, don't jump ahead. We're going to take this one step at a time. We'll just, run these tests. And then she was gone. She had retired. So
you think it's because of that? Because,
I've
there are a
never
lot
talked to
of
her
nurses.
again, but my gut tells me she was seeing too much, and it was just too much.
It's fascinating to me and Mark, who were really into this issue last year. 2021 was the big year that we fought against this, right? It's cooled down, but I don't know. We're seeing signs that this is not fully cooled down. But anyhow, there was these nurses, and it was like it seemed to be 20-30% nursing staff. At least to us, it seemed like it. Doctors were rare. You wouldn't find doctors to go against the narrative, but nurses would, which are closer to the patients, right? And it's fascinating that because I wouldn't be shocked that was the driving force behind getting out of medicine.
Well, she's one in 330,000 healthcare workers who've left the field in the last 2 years. 330,000.
And I shouldn't just assume everyone knows who Mark Bishofsky is, even though he's been on the show many times. Mark, you actually were a respiratory therapist for a big hospital, and you left because you didn't want to get the jab.
Right. Yeah, just I was skeptical for the entire, from March 2020. And, most people watching probably know the story for the most part, but just, I was trying to fight to get people ivermectin, questioning the poke. And it just came to a point where I couldn't handle it anymore, everything. And I could have, applied for a medical, or rather, they weren't giving medical exemptions. Even though I'm vaccine injured from the past, another story, but religious exemption, I could have applied, but I couldn't jump through any more hoops, and I needed to become active and fight this. Again, everyone who knows me knows I'm doing this, everything I do so that my children can have a decent future, and it all just was crazy to me.
Yeah.
Everything I saw in the hospital, early intubation, probably one of the craziest things, and the list goes on.
Yeah. All right, Susanna, so you go to the doctor, you got a nurse practitioner, you don't say to her you think you're vaccine injured, but she's kind of giving you the signal that she thinks that's what it is?
I mean, I told her, hey, this all started within 30 hours after the shot.
Okay, so it's out there.
I'm concerned here. This is nuts. I was fine, and now I'm not, and...
Were you having neuropathy yet at that point? Because isn't that part of what's happening ongoing? Were you having that?
I feel like walking? I can't remember. I definitely had trouble walking, but and by the time I got to the hospital, being in the hospital in May, I had a burning sensation in in my right leg. I got both my shots in my right arm. The lymph node was on my left side, but almost all my issues have been on my right side, which is pretty typical for the majority of the vaccine injured that I know. But extreme burning pain in my right leg, which is neuropathy, and then weird tingling sensations, and like a sensation like water's running down my leg.
Weird.
I have small fiber polyneuropathy that's confirmed. It's and concerning. It's sudden onset small fiber neuropathy. So normally you would get something like this if you had diabetes for a number of years, and then suddenly all of a sudden my nerves are damaged. And in my foot, I've had a second skin punch biopsy is what they do to check for this type of nerve damage. I've had 2 of them, and in my foot it's getting worse. And I can tell it's getting worse. In my leg, though, they took it from my thigh, too, and in my leg it was getting better. So it's burning less here, but, like, my foot's more numb and more damaged. I try not to dwell on the fact that some things are deteriorating. Like, I have tinnitus in my ears. I don't even know if I mentioned that the first couple times I spoke out.
That's being documented now, actually, as a response, adverse effect. So you would also think that's caused by the vaccine that you got?
It's what's happening now is absolutely from the vaccine. So I did have mild tinnitus. It would come and go, and that was documented from 2018. But now this is through the roof. And when I say certain things are worse, like that's worse right now. Like it's so loud right now. And the thing is there's not much you can do for that either. So I kind of just try and let it ride.
So let's go back. So, you're in the hospital. Is that what you went to, or just clinic?
So things kept getting worse. So I went to the doctor like 2 weeks after my shot.
Is this just your local clinic? Not like you didn't go to urgent care or ER or anything like that?
Just a local clinic. But then the middle of May, we're still doing tests. I'm going back to the doctor more often because things are not good and getting worse. And I'm running into more doors and such, and feeling more fatigued, like even worse, like
and
needing to lie down.
Do you work for a living at this point?
I was working, in corporate social responsibility as a VP of corp, which is
that's a place that breeds a bunch of conservatives right there.
That's pretty ironic, I think. I actually have since been laid off while I'm on long-term disability now, but was laid off while on long-term disability, which I also think is ironic since I worked in corporate social responsibility, which is really lacking. And, I'm concerned that is more about marketing than it is about truly helping the people.
Yes, it is.
It took me not very long to figure that out, actually. But I still think it's shocking.
I don't want to ask you who your employer is, but is it a Fortune 500 company?
It's up there.
It's definitely a marketing thing. You're 100% right on that one.
Yeah.
Okay, so you go to this clinic 2 weeks in. At this point, I'm assuming you're already on disability or not. You probably need a doctor.
No, I was just taking time off from work to go to my doctor's appointments.
But incapable of working, I assume. If you're running into doors, that you can't work, right?
I was trying my best. I'm a push-through kind of person.
Fake it to make it, huh?
Yeah, I was trying my best. I mean, I was in severe pain, like joint pain too. And I have joint pain so badly now and have something called cryoglobulin anemia vasculitis, which is literally like coagulation of my blood when it's cold. So things are worse.
Don't all women have that? I mean,
I don't think so. I don't know. Well,
I always ask in terms of the
cold,
heat.
But not coagulation.
Maybe they're cold, but not coagulation.
There's got to be something behind it.
So I ended up going to the ER the middle of May.
Okay, so you go to the clinic first.
Multiple times.
Okay.
Yeah, from the end of 2 weeks after my shot, the end of April through May.
And they're just what are they doing at that point? Like
testing, running blood tests primarily, and then MRIs.
But there's nothing they can give you to help your symptoms at this point.
Maybe were they offering steroids?
They didn't. It took me a year before a vascular specialist who saw me roll in with my walker is like asking me about my history, like, hey, what did you do before? Like you're doing. And I said, well, I was doing triathlons. And he's like, what'd you do for work? I tell him, and he's like looking at me. He's like, well, when did this all happen? What? And I was like, well, it was after the vaccine, but we don't need to talk about that. Like, I just wanted help at that point. I was like, I don't even want to talk about the fact this is a vaccine. Please help me. So this guy's like, well, we should talk about this. And I was like, whoa, you're like one of the first doctors who's ever said this to me. So this guy in, of May of, gosh, I'm losing track.
So was this year then?
2020.
Yeah, it was this year.
Yeah,
it was May of this year that I finally got steroids for the very first time. And that helped what was going on in my leg. Like, I feel like there's razor blades in my leg, although it's popping up again with the weather. But it tamed that down enough that I could walk better.
Yeah, I love the heroes in this story. This nurse practitioner, I already like her, and then this guy. But I have to imagine, it's because she's writing this down after getting the vaccine, the doctors have got a stigma when they're treating you, right?
Yeah, I mean, so many. In my trip to that large institution in Rochester was like the twilight zone. But
okay, to get to Mayo, we're jumping around a lot here.
Yeah,
I'm sorry, because I really am interested in the story. I'm sure the audience is as well. You're going to the clinic a couple times. At least there's being seen by a doctor. They have no idea. There's nothing that they can do to treat you, or is there something that they're doing to?
I'm not getting any treatments at this point. No,
and they don't even have. They're not even speculating what the cause is at this point.
I think that they knew it was the vaccine.
Really?
Yeah. So after the nurse practitioner retired, I ended up with another hero, I would call him, a different physician's assistant, and he was definitely willing to dive in. He ended up. I submitted my reaction to Pfizer, and he ended up filling out the Pfizer paperwork and putting on that paperwork, yes, this is from the vaccine. I've never heard from Pfizer since then and haven't had any updates from them. But so I've had a number of doctors along the way who will admit it to me, but then they go back and forth, and I think there must be a new memo out there telling them not to talk about this or
there's no doubt a stigma in that profession about it, right?
Absolutely.
And it's really fascinating, so we get taken down. We're talking to Dr. Neil Shaw, which is a rarity that you got a doctor that's so openly willing to talk about these issues. And he's just like, yeah, the whole medical profession, certainly doctors, it's amazing. It's like they don't want to stray away from the narrative, and probably for a good reason, because what YouTube will do, right? Or what
their jobs.
Their jobs, the hospital, Mark has to basically
they've got
quit.
Debt, I mean, these doctors have more. I'm a respiratory therapist making, just a fraction of what they're making. So the risk for me to speak out is much less than them with their debt and their paycheck and the homes they have to pay for. And, it's lockstep. There are none of the doctors I worked with, a dozen or more hospitalists, all the doctors in the hospital, not a one of them would talk about it, period. So there's memos going
Which
out.
It's just so crazy to me. The reason I never got this vaccine in the first place is I'm like, I don't want to be the lab rat. I don't, this is experimental. I'm not going to do that. No chance will I do that. And it's like, I mean, I think it's a big moral sin, but let's just get past that. Let's just say it's experimental. We're going to test it. Maybe we can save this world from this pandemic. You still have to collect the data. You still have to be open to the data that's coming in, right?
Hey,
and they're not
guys,
even willing to do that. Yes, William.
Sorry, got a lot of comments that we got to catch up on.
I'm sure we do. All right,
here.
let's get into some of those. And then we're going to finish up the rest of this timeline with Susanna.
So starting with Rachel, she said, my aunt questioned whether I truly cared about my residents if I didn't get the poke. I was so hurt to be questioned about caring about others, being a CNA for elderly dementia patients. My grandpa told me I should be fired. Marianne says, was a big triathlete, per-vax. Maybe she meant pre-vax. I ended up in the ER with neuro symptoms when developed cardiac symptoms. Who would have thought this vax would have been life-changing? Hope we are able to get back to life. Mandy says, I fought my Fortune 100 employer for 4+ months to get a religious exemption. It was grueling and immensely stressful. I don't fault anyone for a second for not wanting to go through with what I did. I somehow found the strength, but now work for a small company that has a much better culture and didn't even ask me about my status, much less require any kind of documentation. God pushed me in this direction, I am sure. And then Rachel said, so sad how much physical pain this woman is going through. Bev says, unbelievable. Any thinking person should have questioned this. The blatant censorship should have been the first red flag.
Yeah, so, and Bev, that's an excellent point. I mean, regardless of where it takes us, we should at least take in the data. And they don't even want to do that when you get a YouTube out there that says, I'm sorry, you got a medical doctor with data and science behind what he's saying, but we can't even discuss this issue. Now, before we get back into Susanna's story, I want to bring up this Megyn Kelly. I don't know how Megyn Kelly has not had this taken down from YouTube. And this is fascinating to me because Megyn Kelly seems to be middle of the road. She definitely pissed off a lot of people on the right when she went after Donald Trump. But she worked for Fox News, so she wasn't far on the left. So she seems to be a middle of the road kind of journalist. Obviously, he hasn't done very well in her career in the last 6 years. She went to NBC, and that was a total bomb. So now she's on Sirius XM. But she did this segment. I think Mark, do you know this? I think she lost her sister, and she assumes it was the COVID vaccine. Do I have that right?
I'm not aware of that story.
Okay. I need to investigate this a little bit more because I don't consume a lot of Megyn Kelly's content, but I came across this. So let's watch this segment, about a minute of this segment on a recent. I think this show was from a month ago.
And then immediately within days after getting vaccinated, 29.4%, 30% of them had cardiac abnormalities following vaccination.
You don't see that all over the media. Vinay, who was also present in that interview, Vinay Prasad, suggested it was more like 1 in 30. The point is, there is a decent chance that your kid could potentially contract a heart ailment as a result of these vaccines. Moderna has higher rates of complications than Pfizer, and dose 2 is considered more dangerous than dose 1. Several foreign countries have banned or discouraged the use of Moderna in young men altogether, but Pfizer also has seen complications. Sometimes the myocarditis is clinical, and that means your kid knows he has a problem. He has chest pains, he's short of breath, etc. You can take him to the doctor. Doctors say perhaps as many as half of all these myocarditis cases, however, are subclinical, meaning your kid might not even know he or she has an issue because there are no symptoms. So you can't get him on medication because you don't know it's a problem.
Okay, Dustin, let's cut there. So, and you could go YouTube this. I think I just did Megyn Kelly vaccine, which shocking me. I don't know how that's still up there because what she's saying there is just as
on a regular basis, that is ramped up too, actually, as time's marched on.
So you're saying you had that prior to the vaccine? Or?
No. I had no heart issues whatsoever prior to the vaccine. So now I get these pounding chest pains. There's chest pain, which is one thing, which stops me in my tracks usually, and I just kind of have to hold my chest and wait because it hurts.
Yeah.
And then I get what's called supraventricular tachycardia, which is really intense palpitations or intense pounding in my chest. And then lately now I'm feeling it kind of flop, which is an arrhythmia. I was actually in the...
Do you feel the positive side of this whole thing is you expand your vocabulary a little bit?
Oh, yeah. I have a mini degree, nursing degree. I feel like I know more.
Maybe you should get a medical degree because you're willing to listen to all sides, right?
The nurses are, though, to your point, and some of the doctors, but definitely the nurses are. But yeah, I have learned a lot, and I feel like I have to be my own doctor because no one's really caring about me in the same way that I am hopeful that I will continue to improve.
And you're an athlete too. You know your body. That's the interesting thing about this.
Yeah.
So let's go back to at some point you're not getting anywhere with doctors in the clinic, so you end up going to the ER. Is that correct?
Yeah. Actually, it was chest pain. It was chest pain that brought
That
me
how
to
you want to go to the ER for that? Yep.
Yeah, so that was my first time to the ER in May.
And this is May, you said, of 2020.
It was in May.
2020.
So I had just ironically done like a CT scan that day, outpatient, and then that night I was like, something's wrong. I told my husband, I'm like, I'm having chest pains and I can't breathe. Like something's not right here. So we went, and I think my rhythms were kind of all over the place, and I believe, I don't even remember. I've been to the ER and to so many doctor's appointments, they all roll together. But at the end of that ER visit, they tested everything. I'm like, well, and I wasn't presenting like I had COVID, but I'm like, can you just test me for COVID? I know I'm not presenting. And she's like, I don't think you do. I'm like, well, let's just test it.
Yeah.
I didn't have COVID. And ironically, I haven't had COVID yet. Like
Really?
I'm one of the last few standing that hasn't had COVID. I've had
You were the
it.
rare vaccinated that actually got immunity from COVID, huh?
Yeah.
You probably had COVID. You realize that. You probably had it. You just
Well,
didn't know.
I've been tested with the
Well, the-
nucleoclasmid
Oh, for the antibodies?
test.
test, though, the cycle thresholds, I mean, the PCR test it is not reliable. It's very easy to find the facts on that. It depends on what the cycle threshold, how many times they spin it.
But that would still give a false positive, so she doesn't even get a
if
false.
it's high, right?
Yeah,
So,
so-
but there's also false negatives. I mean, I saw it many times where I'm working in the hospital. Someone comes in sick with COVID-like symptoms, test negative, test positive.
Yeah.
So you do get those false negatives too. And the inventor of the PCR test, Kerry Mullis, Google him and what he says about using that as a tool to diagnose.
Don't Google him. You won't find anything over there.
Yeah,
DuckDuckGo
search
him, I guess.
DuckDuckGo him, or Google's kind of that generic term to search for
Yeah, I
facts.
know.
But yeah, it's so that's one of the components of this whole pandemic that is a farce. The PCR test is not a reliable tool to diagnose for viruses.
But regardless, I mean, there's a chance, and it makes sense with you because you get injured in 2021, early 2021, and I'm assuming your social life changed drastically at that point. So you're, retreating from a lot of social gatherings that would be where you would get the,
Absolutely.
contract COVID.
And I work from home, so while I was working until things went south. But
Right.
I did also have this nucleoclasmid test that the Mayo Clinic does, blood
You
test.
literally, your vocabulary is so
I
impressive
know.
now.
I was
Yeah.
going to say that's one of my vocabulary
need,
things. I wanted to throw the nucleoclasmid
I feel like I need
test in there.
Dr. Shaw right here at the desk just to, be my interpreter. Although, of course, if we brought him in, we get banned, so maybe that's not a good idea.
Yeah, just bring in this vaccine injured lady. But so that was, I've been tested twice. My blood has been tested to see if I have antibodies from a natural infection. I don't. But ironically, I have still antibodies from the vaccine, or I did the last time I got tested in August 2022. I still had antibodies from the vaccine in my blood,
Wow.
which is crazy.
So that's a year. You're talking 15, 16 months after vaccination.
Yeah.
Jeez. Okay, so you go to the ER. I know it seems like you probably had brain fog at the time, so it's hard to
Yeah.
recall this. But eventually you end up at Mayo.
Well, when I was in
Any
the ER here in the Twin Cities, my husband wanted to go directly to the Mayo, and I was
Okay.
like, no, they have all my stuff here. Like, let's just go here. And they told me I could stay overnight because of my chest pains and heart issues, and get an echocardiogram in the morning, or do it outpatient. And I said, well, if you're telling me I can go and I'm not about to die, then I'm gonna go. I don't want to stay here in the hospital. But then, like 2 days later or a day later, they called me. The doctor's office called me, and they're like, well, how are you feeling? I'm like, well, actually, I'm worse. I actually can't see very well.
Oh
like,
my
I'm like
God.
now having vision issues, like blurry vision issues, and I'm feeling more dizzy. And they're like, well, you need to come back to the ER. And I'm like, okay. So I call my husband from work. I'm like, we need to go back to the ER. It's like, well, we're going to the Mayo now. And frankly, that was a huge mistake. I wish I would have. I hope I don't get in trouble for saying this. Like, I don't want the Mayo coming after me, but like that was my experience. It was terrible. It was like the Twilight Zone. It was awful. I was there for 2 nights. But when I got to the ER at the Mayo, they did a whole bunch of tests. they had me hold out my arms and close my eyes, and my arm drifted. And when I opened my arm, I was like, whoa. And then they told me this pupil was bigger than that pupil. And I'm like, oh crap,
So
I'm
sure
having a stroke.
testing, yeah.
Yeah, I'm like, this isn't good. And then like hold up my leg, and I couldn't this whole side like weaker basically. So I'm kind of like, all right, but I'm like, but I'm here. This is the place I'm supposed to be. At least they can study me. Spent 2 nights there. They said according to my test, I hadn't had a stroke. There is something called an ischemic, to use my big words, like some
transient ischemic attack.
Yeah,
so that's
that
like a
one.
mini stroke where it lasts for a moment or 5. But
Yeah.
short.
And then that one's not going to show on your brain later. So to me, I'm like, I'm pretty sure that's what was going down. I couldn't see. I had to close my eyes to talk. My brain was foggy. I couldn't walk because this leg was hurting me so badly. So I was there. They studied me. They gave me nothing as far as treatment
Are
goes.
they asking like what you think was the factor here? And did you
Yeah, I
openly
mean,
say it was post-vaccination?
Yeah.
And do you feel like that gave a stigma to the medical professionals that were working with you?
I do. Yeah, I definitely do.
I mean, just
know.
think about that. It's so crazy to think. You know, we all discussed this back then. Like it's almost like what was the term we used? Well, maybe I won't bring that up. That will get us banned. But it was so unbelievable the way they were treating people. The end of Stu Peters. I love how he's got the clips of people in the media. I didn't know Dolly Parton did that. She turned her hit Jolene into Vaccine. Unbelievable. Yeah. Dolly Parton, how dare you? But they were, I think it was Jimmy Kimmel, which that guy's such a lost cause these days anyhow.
Colbert, all those
yeah,
guys.
all like saying, well, you know, you shouldn't even be able to get medical attention if you stay unvaccinated. Like that's the way that they treat it.
Right.
It's almost like worse than someone that's unvaccinated is someone who is vaccinated and claims that was the cause. That's how they treated you guys.
Like I have a lot of friends who their injuries came after their first shot, and then they're half vaccinated. I used to call myself lucky because for a while I was fully vaccinated before like the boosters came out, but my half vaccinated friends still couldn't get into restaurants and such. Like it's sad.
Yeah, it's sad. So Mayo was a bad experience to you. You felt there was a stigma. Is that why you said it was such a bad experience? Was because of that, or
I think what happened is they gave me like so many medications that then made me feel worse. Like they were medications to treat symptoms, but not steroids, ironically, which would have helped me significantly, to be honest with you. But like things for the dizziness, things for the pain, and like Percocet and stuff like that. And all of that for me wasn't making me feel like, it'd give me maybe a temporary break. But I think like the interactions too made me feel worse ultimately. And I do know that the Mayo Clinic got like $200 million in CARES fund. I think you might know that better than me. I think you're.
Yeah, it's something like that.
So for COVID, so it's like COVID's okay. And they really wanted to say that it was from a COVID infection. And I hadn't had COVID yet. And even my nucleoclasmid test, I got one, that test, that blood test that looks for antibodies. I had one in November 2021. I had one in August 2022. Still haven't had COVID. There are a few of us out there, I think, frankly, and maybe I'm genetically immune. Maybe I had a SARS virus in the past that built up an immunity in my system that I just never got it and still haven't. I expect that I will. But I'm like, study me now, quick, study me now, because I haven't gotten it yet. It's not in my blood yet. But I had a reaction. So let's figure this out. I'm having heart issues. I have neurological issues. I have autoimmune issues. Like,
did you play this song and dance in with medical professionals all the way up to May of 2022 when you finally had somebody, a physician assistant that came and said, let's treat this with steroids? Is it just no one wants to approach the subject? No one wants to put the blame on the vaccine?
Yeah, I feel like I did have maybe one neurologist, and we in the vaccine injured community talk to each other. And I did start Minnesota Team Humanity trying to get, and I would love if there are any injured out there, like we have an email. You could email to get connected with us because.
What's the email?
And I don't remember I know it's like is it Proton?
Proton, yeah.
.me maybe, but I think it's mnteamhumanity at
Proton.me. Yeah.
Yes,
Or is
that.
it .me? That's
Some
Proton.
of it's .com.
Oh, it's
some of them are-
protonmail.com. I should know this by heart.
Yeah.
Some of them are actually .me. Some of the newer
Are they?
Proton Mail accounts.
I got an old one. Yeah. Well, first of all, we'd love to be a platform for anyone that wants to talk about this because we just don't give a crap about YouTube anymore. Like, you can censor us. I guess Dawson wants me not to post on it for at least a month so that they don't remove all content. But I'm not going to censor what I'm going to say. So we're going to just stay on Rumble. Rumble's doing a great job. They're letting us out. And that's a scientific process. We have got to share information. How do you not study Susanna? It's crazy. Like,
or the hundreds and thousands of us that are like me. And I mean, how could we all have these similar, there's a big load of symptoms, but we all have similar symptoms. We all got, how do you get sudden onset? How do I damage my nerves suddenly? Like,
That's a crime against humanity, that they are unwilling to look at the elephant in the room. This new product, an mRNA vaccine that is literally in testing, and somebody comes in shortly after they take this new technology and has all these strange symptoms, for these doctors not to just jump on and by principle try to figure out what is happening, that is a crime.
that's right. We did a rally together, or a candlelight vigil, I guess it was how it was framed, November 2021. So at what point did you actually come out and share your story?
You called
publicly?
me, I think, right?
I did. You know, I think Stacy connected us. She's like, somebody I knew from work in the past said, you should really tell your story. And then she connected me with you. And I remember our conversation, Mark.
Yeah, I cried. It's still emotional to me. What's happening in this world should be very concerning to everyone. But I believe it was before a September rally, just a few days prior.
It was
I having a
October
big-
23rd,
Oh, yeah,
I
it was
think.
the October rally. It was the
Mhm.
one Del Bigtree was at. One of those, but I think it was just 2 or 3 days before the rally. You had reached out to me, and it was amazing. You captured the audience. People were in tears. And
Well, I felt the love big from that. And frankly, as a Democrat, I was afraid, a little bit afraid. I'm like, should I do this? I'm going to be standing in front of a bunch of people who maybe think differently than
there
me.
were many Democrats in that audience.
Yeah,
Many Democrats have approached
and there
me.
should be, right? Because it's not about red versus blue. And that's why I wear purple. I wear purple all the time. Anytime I speak out, it's the intersection of red and blue politics. Where humanity starts. And that was our conversation. We're like, okay, we don't agree with 100% of how to approach this necessarily, but we agree with humanity and human kindness. So then the opportunity to speak in front of the crowd and say, hey, it's about us pulling together. The
Right.
problem is we're getting pulled apart. We're focusing on we're focusing on the outer edges of where we're different, what we don't agree with, rather than like looking at suffering, which no one wants human suffering. Or maybe there are a few top elite people who are down with human suffering, but
Which are probably the ones that are instituting the mandates.
it's
Isn't that interesting?
it's possible.
It's 100% possible. The story of people in charge of people, governments, institutions, dictators. These are the people that do that stuff. They want suffering.
Certain
Just-
amount of
just
them
open
are
up a history book.
sociopathic. Definitely, there's a part of, you look at government and these people that want to control people. Human beings are flawed to a certain degree. Take a subset of these flawed human beings. I would argue, the most flawed, the most corrupt, lying, manipulative people are, I believe, what make up our government and top corporate, executive.
And just look at the Democrats who just ran on standing up for a woman's personal health care decisions. I mean, I heard Walz say this many times. I trust women with their own health care. I can't believe people don't call him on this. All you care about is abortion. You did not trust women when it comes to how they handle the pandemic. You said you got to be stuck in your home unless you're an essential worker. If you're an essential worker, then you can go. He says you've got to get a vaccine. Luckily for us, it was only state employees. That's the only purview he had. But I'm sure if he could, he would have mandated on everybody. And it might actually end up happening in the schools with children. You don't trust these people with their healthcare decision. And if there's ever a rallying cry for the right and the left to come together, it's on your own health decisions. That's the most basic fundamental thing, and we couldn't get that right. And it's so sad that it's plagued the whole medical profession, other than these heroic nurses.
I'm hoping that part, I think people can see the hypocrisy on both sides of that, right? Like, I hope that. It's possible that we don't agree on the opinion of abortion here in this room, but where there is a risk, there should be a choice with this vaccine. And I'm an example of the risk. And I know many other people. I'm connected with 40 Minnesotans at this point. Again, would love to connect with more if they're suffering alone and didn't realize that they were or thought they were alone. But it's odd to me that you can say, hey, you have to get this vaccine as a mandate, but then say, like, women's right to choose. So how come we don't have a right to choose about the shot, but we have a right to choose about abortion? So, like, and it can go the other way as well. Like, how
they don't even, listen, politicians don't even trust you to smoke marijuana, right? Right now that's still illegal in Minnesota. So you can't even do what you want with your own body, even with a harmless drug. So they're just hypocrites in general. They're hypocrites. But I think nothing exposed that more than COVID, and where they didn't trust you with any of your decisions. You were a danger to society. You were killing grandma if you left her home during COVID. Meanwhile, now we know those of us in the lower risk class should be getting outside, getting vitamin D through sunlight, should be, working out, losing weight, all that kind of stuff. That was the healthy activity. Did you know that Tim Walz said it was illegal to camp in state forest? Did you know that? That was part of his ban. Unbelievable. What do you got, Dawson? Oh, yeah. Well, let's go to a couple more comments, William. I'm sure there's more there.
Yeah, there are. So we have a question from Deborah that maybe you guys can answer. If the Supreme Court found it, and it disappeared, where'd it go? If the Supreme Court found it unconstitutional at the federal level to attempt vaccine mandates, how can they do it at the state level?
Say that, if they did what at the federal level? What'd you say?
They made it illegal to mandate vaccines. How can they do it at the state level?
So I guess she's referring to them overturning the Biden administration's mandates on employers over 100. Although what's fascinating about that decision, they can still mandate them with medical professionals because they receive Medicare payments and Medicaid payments, federal money. It's unbelievable how the Supreme Court can even make a decision like that. Like, how about none at all? Just because the federal government moves money? Well, using that logic, why couldn't anyone that received the PPP loans, a private employer, also then be found that they could mandate vaccines? But anyhow, long story short, it's a fascinating question. The way that they're going to do this in Minnesota, because I think at this point most of the general population mandates are off the table. So the little one that they're sneaking through is the CDC already recommended the COVID vaccination on the immunization schedule for 2023, which and they've already approved it. I think at least 5 and up. It might be lower than that. Do you know, Mark?
I'm pretty sure it's 6 months and up.
I think you might be right on that. So Minnesota has a couple functions where they can adopt what the CDC does, and you saw what we posted at the beginning of the show. YouTube says, what does WHO say, right? So these guys all point to a credible institution, and most in America point to the CDC. So what they'll do is they'll take the recommendation of the CDC and implement that, and that could either be through legislation or the Department of Health Commissioner in Minnesota could do that. So that's how they get around that. Now, obviously, I think your question is, it's probably ended up in court, right? And I think there's a valid case here, but my God, I'd never want to leave things up to court, certainly not here in Minnesota. So I guess that you got to...
No, just a million things like I said. But in 2019, it was, I think, Representative Freiberg tried to get a bill through that would mandate all vaccines on all children, whether you're homeschooled or private or public school. So, people think they'd be crazy to try to do this, but I think you'd be crazy to think that somebody doesn't have that thought in their head where they're going to try to get this through.
Right.
What I wish more people knew that I didn't know before I was injured is that if you're injured from the COVID vaccine specifically, you're only able to apply for the Countermeasures Injury Compensation Program, CICP, versus the Vaccine Injury Compensation Program. Countermeasures, you don't even have the ability to bring a lawyer with you. There's no court. It just is what it is. It gets decided by HRSA. And so you're out of luck. And to date, as far as I know, or at least from a couple of months ago, not a single person in the United States has been paid a dime. And I can tell you, I'm out now. Technically, I owe an institution here for a chemotherapy treatment that I did. I owe them $80,000 because my insurance said that they weren't going to pay for it.
And if anyone is paid out, it isn't the pharmaceutical companies that
it's
pay
us.
it. It's us. In 1986, the Protection Act. I mean, these companies have 100% liability. And let us not forget that Pfizer was sued for the largest fine in criminal justice history in 2017, $2.3 billion for lying, manipulating data, and bribing doctors. This is the same company that we are trusting. And you can go with Johnson & Johnson with their asbestos-laden talcum powder. You can go with Merck and their Bextra. These companies don't necessarily care about our lives.
Yeah, it's interesting. They've always had that stigma, and yet they're heroes all of a sudden in the pandemic.
Right, you'd think the Bernie
also they're
Sanders
angels.
followers of the
Yeah.
world would be, these against corporate corruption would be the first ones against this, but it turns out no, the narrative didn't suit that.
And
Crazy.
the clinical trial data that the FDA, together with Pfizer, wanted to keep under wraps for 75 years.
And then
years, yeah.
ICANN just had to sue the CDC to release the V-Safe data. So everyone knows look this up too. You can find this information on Del Picture's The Highwire website, but everyone knows about VAERS, the Vaccine Adverse Effects Reporting System, which is underreported. We've got 30,000 deaths so far reported. Historically, 1 to 10% are reported. So that could be anywhere between 300,000 to 3 million. 60,000 permanently disabled. So the VAERS data is out there, but what people don't realize is they created a different system called the V-Safe data system, which they were trying to keep hidden, which ICANN had to sue in a FOIA request. They did get some of that documentation, which shows what these companies don't want to be seen. I don't have that data, but they're still hiding a lot of it.
Right.
So they're hiding information. Why? Let's have some transparency here in this experiment.
Yeah, well, not on YouTube, because if you even talk about this, they're just going to take you off. Strike 2. All right, what other comments we got here, William?
So I had missed one from earlier on
then
Rumble.
you're fired.
Rumble doesn't update right away. Kelly says, as an RN and unvaxxed, I feel like my job is constantly on the line. Sounds like the federal government is doubling down today on mandates and vaccine push.
Interesting. Is there some headline that we missed today?
Well,
Are you with us?
no, but they're still mandating.
Yeah.
I mean, there are,
That's true. Yeah.
They're still mandating in hospitals. Nurses, the RTs I talk to are very afraid. My wife's a nurse practitioner. She's terrified of what might become of her career. It's still getting ramped up. Look, the G20, they just recommended vaccine passports moving forward for everyone, for all travel. I mean, this isn't going away. It's our fight against this. It needs to ramp up because it's not going away.
100%.
And there is no safety net if you're hurt, because this CICP program's not working, and you're gonna struggle in the doctor's office. So people need to know that, I think, before they continue to get boosters. And with mandates, especially with our children, that concerns me more than anything. This is experimental. I've had conversations with the Minnesota Department of Health multiple times, and I said to them, hey, I'm concerned about our children's immune systems and their fertility. We don't know.
We don't know on
we
that
don't,
one.
and they agreed. We don't know. So how, if we don't
God.
know,
That's
if we don't know, how can we mandate at this
and
point
children
in time?
are not
and
at
children,
risk. Their
All
risk
right.
is essentially zero. at this, and they have carried such a burden. You look at these pictures of they're in their tents at school and these boxes. This whole generation of kids is going to be fearful for the rest of their lives. Let's not kid ourselves. They're going to remember this. They're afraid to breathe the air. They're afraid to be next to people. This is major, what they've done to the kids who carried no risk. And I always said it's like a terrorist would take women and children and put them in front of, the danger to protect themselves. When in the history of the world have we, exposed the children to the danger to protect the elders? It makes no sense.
It makes zero sense. That's right. And I know a lot of grandparents, pretty mid 2020 were like, all right, that's it. I'd rather take the risk. I'd rather see my grandchildren than live in solitude, right? 'Cause that's what a lot of these people are doing.
Solitary confinement for the last couple of years of your life.
You said there's no recourse for those that are harmed. And I'm like, yeah, but that's not even the worst. There are people that are dying.
Yeah.
Do you feel like you could have been one of those deaths? Maybe if you didn't have as good dietary regiment or weren't as healthy as you were? I mean, do you feel like what happened to you could have killed another person, and that's probably why a lot of people are dying?
And that story is a little heartbreaking for me. I don't know if you know Ernest Ramirez. I'm getting choked up. His 16-year-old son died. He's in Texas. He died a few days after his shot. He had the exact same lot number that I had. So yes, he had the same lot that I had, that, just a day before or a day after me. And I wonder every day, like, why am I still here? And that 16-year-old, is gone from myocarditis.
What you could tell us, healthy 16-year-old?
Yeah, he was a healthy 16-year-old. His dad does a lot of speaking. I'd love to connect you with him.
Yeah, for sure. And do you feel like, because obviously a lot of people got the shot and not everyone ended up in your condition. There's just something with your genetics that doesn't go well with this mRNA technology. How does that?
We don't know,
Lot
right?
numbers, you kind of brought it up. There is a theory, and I think there's actually some evidence behind it that some of the lot numbers caused many more of the side effects.
I have seen that. How Bad Is My Batch says that 90% of the VAERS reports come from 5% of the lots. So it does. I mean, with any manufacturing, I like to say this, like, we hear that people died from bad spinach, and we pull that spinach off the shelf.
That's
like
right,
they got E. coli, right? Or manufacturing, there are lemon laws for cars.
Yep.
Like the same thing is going to absolutely happen with mass manufacturing of a vaccine. As a result, I mean, there is a vaccine injury compensation program. Like, so vaccine injuries are real. So the fact that we're pretending they're not and not studying them is going to get the everyday person at a disadvantage. And that's where we have to talk about injuries. It starts with talking about the injuries. Right. I just don't want to see, especially the young people, anytime, and I've met so many, there are a couple here that I'm connected with of the 40 that are, of the 40 Minnesotans, and they're young, and their lives are a complete mess now as a result of their vaccine injury, primarily heart conditions, and it's just not fair. I mean, I'm 50 now, and my life is very different. I can't move around the same way. I can't do the things that I want to do, but these younger people, and then when you talk about children and then losing lives of young people, like Milo is a 6-year-old here in Minnesota who, you've met him. Yeah. I mean, it's...
Milo's vaccine injured?
Yeah, okay, myocarditis. He had myocarditis. He had underlying health conditions before, but...
He's seriously injured.
Yeah, it's horrible. Like, And then I worry about, I have a savings account that I'm blowing through, and I have the wherewithal to like try and fight the insurance companies when they come back and say they won't pay for the chemotherapy that my doctor recommended. I've had IVIG, it's called intravenous, to throw out my big words for you just at the end of the program here, intravenous immunoglobulin, like this treatment. It's like an antibody replacement treatment. It's like an antibody transfusion. I've had that denied twice by insurance, but I know how to like fight that fight, and I've got, my husband, I've got an amazing group of Minnesota Team Humanity people behind me. You all are a part of that, and I worry about the people who don't. I mean, we're having suicides left and right with people who were previously young, healthy, even older. It doesn't matter, frankly. Like, people are giving up because this is scary. It's horrible when it happens to you, to have neuropathy burning all over your face and your body, your palpitations going. You're like, am I dying here? I've learned to be like, oh, here it comes. I'm not dying. But I wonder how long my heart can handle what's happening too.
Well, let's hope a long time. My God. Yeah, 50. You can't go at that age. Jeez.
Yeah, it feels young.
Yeah, it's young. William, what other comments, questions here before we sign off? I don't want to keep people out of the conversation.
Yeah, so there's one here I thought would be interesting to bring up. Mandy says we need an alternate healthcare / medical system.
100% with that, right? Because I don't know what we do. I remember about a year and a half ago, I was like, God, what happens if I have like not just COVID reaction, but like any kind of thing?
Well, someone also brought up, what if you need a blood transfusion?
Yeah.
That's because they're accepting, vaccinated folks to come and donate blood. So they're recommending use the Jehovah's Witness protocol, where you don't take the blood unless, you come to that point where it's like, I'm going to die without it, but that's a fear. But yeah, we need a new system. The healthcare system is a failure. It's the medical industrial complex. It's the number 3 or higher cause of death in this country is iatrogenic, meaning doctors and medicines cause these deaths. They don't prevent anything. They lie about so many things. They use statistics and manipulate them. Like statin drugs, for instance, is just one example. They use what's called relative risk instead of absolute risk. It takes 100 people to take these statins to save one life, but then when you look at the side effects that come with these, it's like, it's a mess. And yes, you're right, Mandy. We need to change the system. I don't know, where that starts. I think changing people's diets is a start, and going back to more natural, alternative healthcare methods. We have to do something because we cannot count on the current system.
Well, hold on, but I don't have to do Susanna's fish and vegetable thing, right? I can still eat red meat.
Yeah, eat grass-fed.
Oh no, she's like
grass-fed.
She's looking
meat,
at me.
though.
She's like,
don't do it. No,
grass-fed meats. Your venison.
My venison's pretty
these
healthy.
Animals that are raised as they were intended to be raised by God. Cows are not supposed to eat corn. They have a rumen that will, ferment grasses. They have to get all these antibiotics and all this stuff because they feed
like
them.
a good marbleized steak.
I love corn-fed beef.
Yeah.
I don't like
Well,
grass-fed.
first of all, they're only eating corn in the last 3 weeks, just to really fatten them up. They're still eating grass most of the time. But fair point. It's a tremendously different looking meat when you get grass-fed beef.
It's not
right?
as tasty.
I think it's got a... but I eat a lot of wild game,
So
there's a
gamey.
taste that I like, a richness to it, right? Because I like the richness to a lot of wild game, especially elk.
Right, and look at
Elk's
glyphosate. That's another thing. We poison our crops. I mean, I don't know what you do. We need to have, massive, food production, but there's so many poisons in our foods, and they're not talking about that. The powers that be. That's why I originally, when this pandemic started, right away, I'm like, what? They're gonna lock us down because they care about us?
Right.
Right. Give me a break. So.
I think the food piece is huge, and the
Yeah.
processed foods and what the dyes that we allow in the United States that are banned in other countries. Like, that's concerning. Do people know that? Like, do people know that all these laws that get passed, or just the corporate social responsibility that we're lacking? I think we like to point the finger at each other, or the powers that be like to point the fingers at us as doing harm, but corporations they're the ones making money. They could do a much better job of maybe absorbing some of the cost of the higher cost of putting sugar rather than high fructose corn syrup in our food. And again, if we just sit here down amongst each other fighting and letting these guys pass their laws through Congress, we're not going to get anywhere. We need to start banding together as human beings and demanding these things that are bad for us change, and demanding humanity. Like, having vaccines for children at this point, requiring vaccines for our children to go to school, this particular vaccine, I'm saying, the COVID vaccine, no. Like there isn't a safety net. They're getting harmed. Why are we harming them? We don't know the future impacts. So we need to.
And the more current strains are even far less severe. Even Delta wasn't affecting kids that much, but which is good because that one was a bad strain for adults. But like the current strains are just weak.
It's a typical coronavirus or less. It's just not really, I'm sure if you've got some serious comorbidities, you're at some risk, but you're at risk for flu and any other typical rhinovirus or coronavirus. So right now, to be pushing this vaccine on anyone does not seem right.
And I know the story of 8-year-old Riley, who was in the psych ward for 3 weeks, basically, because she lost control of her bladder. She couldn't walk anymore. She was having straight up Guillain-Barré reaction, but they weren't believing her because it was from the vaccine. So eventually she found react19.org. I'm on the board of react19.org, and we have a care fund for those people who are injured. So because the government's not doing it, we, the injured, are doing it for the injured. So she got funds from the care fund, was able to meet with a doctor who then she got that autoantibody treatment and is back in school. But we caught her in the acute phase. She found us in the acute phase. If you get to the point that I am at, like I'm in the chronic phase now. When I was at that clinic in Rochester, had they given that to me at that point, maybe I wouldn't be in the acute phase. But I've learned so much I wouldn't be not in the acute phase. I was in the acute phase. Maybe I wouldn't be in the situation that I'm in.
Maybe.
That being said, I've met some amazing people along the way, and I've learned so much, but at a big, big, big cost.
And you extended your vocabulary. So I'm a glass half full kind of guy there. Extended vocabulary. Obviously, hindsight, you would not have got the damn vaccine. Crazy. Well, thank you, Susanna. I appreciate you sharing your story today. We might have you back in again because I don't think we're done talking about this topic, Mark. I think this thing's getting a lot of traction.
We were going to talk about the Died Suddenly documentary.
We'll come back and do that.
Yeah.
So, and I wanted to bring Dr. Neil Shaw on again to talk about. Maybe 3 of us could deal with it. Maybe we could have Stu Peters. He didn't look like he actually was the one behind the camera doing it. Maybe he was
he's one of the producers.
Yeah.
He's got a very professional crew, and they just keep getting better and better at what they do.
Well, it's got 5 million views in 36 hours, so it's obviously doing very well, and it's on Rumble too, so that's great. So yeah, check that out on Stu Peters.
Yeah, so if you just go to Rumble and if you search on there, Died Suddenly. For me, it was the first documentary that popped up, and it's compelling. It's very, very well done, and I would say very hard to argue with what they present. I mean, it's I don't think it's too conspiratorial.
I don't know. I
Some
think
of
the conspiratorial part,
the depopulation part.
Yes,
You could debate that, but
yes. Although it is interesting because they have been talking about depopulation for a long time. I think this is explained, honestly, a bunch of people trying to make some profits. I think Pfizer was like, wow, look at this big payday coming up. There's no better profit day than the federal government printing money, first of all, because they don't have the money. So they print the money to buy up your whole supply, and in some cases, mandating it. So it's like, to me, the profit incentive is huge there. That explains it. And then you got all these crony politicians that give authorization to do it. What was that? Emergency authorization to do this experimental drug on the population. Yeah. And then too many of us out there just don't do our own research, right? We got to do our own research. And, some of it's not necessarily our fault because we go to Google. You say Google that, right?
Yeah.
Well, you're not going to find it on Google.
Right, you don't.
YouTube takes down our show with a medical doctor.
Yeah, so
crazy.
I would say you might be right that it's all about money, but you might be wrong. I'd like to know of all the people watching this, if you just put in the comment that if you think yes, it's depopulation or it's for money, because I feel like I know at this point that there's something nefarious going on. The way that they pushed remdesivir and hit ivermectin, everything that you look at with this, if you really do a deep dive, something is not right. And they have been talking, like you said, about depopulating since the 70s. There's so much research there. They admit all over the place that population's a problem.
Yeah. All right. Mark, I'm going to have you back. We'll talk about that. Thank you guys for tuning in. Thank you for commenting and asking questions, and we'll see you next week. And have a good Thanksgiving.